Hello, everyone. It's Laurie White with the Greater Providence Chamber of Commerce, and welcome to episode number 185 of Chamber TV. And we are here today with Dr. Michael Wagner, who is the brand new President and Chief Executive Officer of the Care New England healthcare system. And I'm pretty sure most of our audience is very familiar with Care New England, but for the purposes of being complete, let me just mention that it is the healthcare organization that oversees Kent Hospital, primary care facility in Warwick. Also, Butler Hospital that deals with mental health issues, and of course, Women and Infants Hospital, the region's most prestigious hospital for the delivery of newborns and maternal care. So, Dr. Wagner, welcome and congratulations on your new role. Very important community asset in Care New England.
Well, thank you, Laurie. It's a pleasure to be here, and it's great to join Care New England and Rhode Island. So yes. Very much enjoying my time so far.
Indeed. So a warm welcome to Rhode Island, but you are hailing from not too far away, just over the border in the Boston area community. So why don't you tell us a little bit about your background and what led you to join Care New England?
Great. Well, I grew up in Ledyard, Connecticut, for those who are familiar on the other side of Rhode Island, on the Connecticut side, and went to Connecticut College and Georgetown for medical school, and then Dartmouth for my internal medicine residency training up in Hanover, New Hampshire. My career over the last 32 years has really been in the area of not in the clinical part of general internal medicine and hospital-based medicine, and administratively have taken on progressively larger roles within organizations, mostly focused around hospital management, health system management, physician practice management, and also in insurance-based medicine, more on the provider side of the world. The work we do as providers that's related and interrelated with the insurance industry. And so coming to when finding out about Care New England and that Jim Finale was going to be retiring, of course, understanding that Women and Infants is an amazing organization, has a reputation that goes way beyond Rhode Island and even the region, with a national reputation in the care and research that it provides. And learning more about Butler as a premier behavioral health hospital, with the relationship it has with the Providence Center and providing needed services for so many individuals in Providence and in Rhode Island broadly. And Kent Hospital as the second largest secondary hospital acute care facility in the state, second largest emergency room, and really an important part of healthcare delivery in the Warwick area of Rhode Island. So when I started learning and hearing more about Care New England, it had all of the foundational aspects of healthcare delivery that I'm passionate about, which is primary care, population health, women and infant care, behavioral health, and emergingly a very important footprint in geriatrics. These are the foundational aspects of healthcare delivery, and Care New England embodies that. And in fact, I like to say to people here that Care New England is really the foundation of healthcare delivery in the state of Rhode Island. To me, that's a really enticing and powerful position for Care New England to be in, as we're in a very important time of healthcare delivery and transformation, given that we're coming out of an amazingly difficult time with the pandemic and the stresses that are currently resident within healthcare today.
So you reference an important transformational moment in healthcare. Yes, I think that the business community is, acclimating from both a workforce perspective and also from an economic perspective to the next iteration of the COVID-19 virus. But I'm curious to hear from your perspective, what do you see as the overarching issues facing Care New England and healthcare in general as we are, reaching the inflection point that you indeed mentioned?
Yeah, so let me start at the broader kind of macro level around what we call the move to value. And if you think of value in healthcare as the ability to provide high quality care, efficient care, and look at that from a value equation perspective, at the top part of that equation, or at the things that we deliver: high quality care, reliable care, patient care that is highly exceptional from an experience perspective, and equitable care. And so those are challenges and the goals we have at the top part. And then on the bottom part of the value equation is cost. And as we know, in the US, our healthcare costs are far higher than most other developed countries. And the challenge for us is to move to a more value-based equation. So that means improving the quality, improving the experience, improving clearly health equity, which is a real issue, not only for Rhode Islanders, but also broadly across the US, creating a more equitable healthcare system, and creating a safer environment for patients to reduce all forms of harm. And you can either increase those pieces or figure out ways that you can reduce cost. So what does that mean actually for healthcare delivery? Well, increasingly, our ability to move care from outside the most expensive part of the healthcare delivery system are hospitals and being admitted to the hospital. And so there's a lot of movement to move care that we do traditionally in the hospital to move it into more ambulatory locations. So for surgery, that might be day surgery. You go in the morning, you get the procedure done, and then you go home the same day. Well, increasingly, we're doing those procedures in facilities called ambulatory surgery centers. It's a far lower cost environment. It is they're very efficient and very oriented towards providing care in a very efficient way, in a very highly satisfying way. And instead of getting care in a hospital, it might be more cumbersome to work with. It might be more complex. There are a lot of moving parts when you go to a hospital. Instead, you can go to an ambulatory surgery center, go in, get the procedure done, and then be able to go back home. Increasingly, we're going to see more and more procedures and care that's provided in the more ambulatory environment. That actually reduces cost, improves quality, and also improves the experience for people who are undergoing those procedures. Another source of value creation in healthcare today is around eliminating unnecessary care in the hospital. And for example, patients who present to the emergency room with congestive heart failure or cellulitis, which is an infection of the skin, many times patients with those conditions don't need to be admitted to the hospital, and they can be treated in the home, but they need more than just a prescription. They actually need somebody to come and check on them, to check their weight, check their vital signs, and make sure that they're actually getting better from the therapy that they're getting in the home. So, for example, Kent Hospital, we've developed Kent at Home, which is for patients who are eligible based on their clinical criteria. Those patients being identified in the emergency room or in the emergency room, and then our team evaluates the patient, and then we'll have the patient admitted to home. So it's, for all intents and purposes, looks like they've been admitted to the hospital, but they're now at home. And we have nurses that go out and visit with the patient twice a day. The doctor goes out every day. And we partner with others in the community to provide durable medical equipment and other equipment necessary in the home. And the patients are continuously monitored for vital signs. And they can get the hospital level care, but now in the convenience of their home. Now, is this available for all patients? No, because you have to be of a certain clinical criteria, meet that criteria. And if you do, you can actually get your care in the home. That also creates a higher value equation, because now you're taking patients who would have been put into a hospital bed, who have been potentially exposed to serious bacteria that are resistant. They're less likely to have things like a fall, less likely to have things like delirium or being confused while in the hospital. They're surrounded by their by their family, and they have exemplary nursing and physician care to make sure that they're on their road to recovery. These are examples of the transformational nature of care that we're embarking on. The third area is an area that I'm particularly interested in, which is in primary care. In primary care, and there's been recent news articles about the foundation of healthcare delivery is really founded around access to high quality primary care. And Care New England has been deeply committed to our primary care physicians through our Integra ACO network. But primary care is challenged because increasingly there are fewer primary care physicians. So that means that there are either more patients who aren't getting access to primary care, or primary care physicians and teams that are taking on more patients. And this requires that we start to think about primary care in a more team-based approach, in which we have the primary care physicians have access not only to the care that they provide, but to nursing care in the office, nurse navigators, pharmacists, social work, behavioral health workers. In fact, a multidisciplinary team that's caring for a group of patients and doing it in a highly efficient way, but also highly satisfying way, not only for the patient and their family, but also for the care team that's taking care of the patient, the nurses, the doctors, and everyone that I mentioned, social workers, behavioral health workers, because increasingly that team wants to feel as though they're having an impact in that person's life. Even though they're not in the hospital, many of those patients require a very high level and intense services over a multi-month period, especially if they're going through an acute bout of a chronic illness or have a chronic illness that requires a lot of intense therapy.
We're talking to Dr. Michael Wagner, and he is the president and CEO of the Care New England Healthcare System. This is episode number 185 of Chamber TV, and we're talking about trends in healthcare. We're talking about equity. We're talking about quality, reliability, and new ways of treating the patient and the family while delivering value and quality. So I'm really fascinated by this hospital at home concept, Dr. Wagner, and I'm wondering how this new way of practicing medicine, as an example, and you mentioned physicians going to the patient's home on a daily basis, is that changing the way that we collectively as a society are training our physicians in medical school, as an example? And, how is this correlated with the very close relationship that you have with Brown University and the medical school there?
Yeah, it's a great question, and thank you for thinking so far ahead, because you're absolutely right. In order for us to do this in a way that will really hardwire this into the future is how we then connect it to the education that occurs for medical students, residents, and fellows that are going progressively through their experience. The first part of this is that many organizations, and I have struggled with how to set up a hospital at home. There has been somewhat the requirement of some of the payers to change the way they are willing to pay for these services, and those things have been developed that now enable us to get reimbursed for the services that we provide. The point I'm getting at is that there's a lot of infrastructural work that we have to do from a reimbursement perspective, from a care delivery model, and from a clarity of roles, responsibilities, and protocols perspective. And there's, over the last 5-10 years, there's been work done to really develop those pathways and protocols. And that's what Kent has implemented through its Kent at Home program. Once you have that foundation of care delivery model well worked out, it's then the opportunity to introduce students and residents. And students are the medical students who are at Brown University School of Medicine, for example, and then residents are trainees that have graduated from medical school and are now in a specialization training like internal medicine, family medicine, pediatrics, and other specialties. And so the medical students or residents, now that we have the structure set up, we can then create rotations, clinical rotations, that then support and educate students and residents in this new emerging area of care delivery. Family medicine has been, of the specialties, has been a little bit probably ahead of the other specialties because they have been so focused around primary care and the holistic nature of care delivery. And so family medicine would be a natural to be part of the educational program. And the chair of family medicine for Brown sits at Care New England. And it's an opportunity for us to meld both the clinical delivery model and also our training and educational programs. But the specialties for training would be family medicine and internal medicine would be the likely specialties first off the bat.
We did have the opportunity to talk to the new dean of the medical school at Brown, Dr. Jane, a couple of months ago in connection with a milestone in the existence of the medical school. It was back late summer, early fall when they were celebrating their anniversary. So I'm wondering, during those conversations with Dr. Jane, he talked about really reinventing the relationship between and among Brown with Care New England and Lifespan, particularly on the research front and the expression of new research dollars and cultivating new opportunities for companies to emerge on the other side as a result of the intellectual property being driven and really created through the healthcare systems. What is your point of view on how that's working so far, and what can we look forward to in the coming months relative to that?
Yeah, boy, there's a lot in that question, Laurie. So I'm going to give it. I'm going to
pick and choose. Pick and choose.
Yeah, I'll pick. There's a lot there. Well, one is, one of the things that was clear when I interviewed for the role, and as I met with key members of Care New England and also Dean Jane and other important members of this community, is that Rhode Island is sitting in an environment which is very competitive. And healthcare today is a very competitive environment. There's a lot of change going on. There's a lot of investment that's being made in venture capital and private equity of trying to figure out if there are different ways of providing care. There's also expansion of other systems to the north in the Boston environment, and there's two very large systems in Connecticut. And so one of the things that was very clear is that from a policy perspective, there's a great interest in Rhode Island being more collaborative in how we think about healthcare delivery for the state. And to that end, Dean Jane was on the search committee for this role. And so I got to meet him right off the bat and have a terrific conversation about how we in the state of Rhode Island can be working more collaboratively with each other to advance healthcare delivery for Rhode Islanders from the great organizations that are here: Brown University, the medical school, Lifespan, Care New England, and others. And I think this is a unique time in the state of Rhode Island for us to think about how to create a collaborative environment, because I think none of us want to waste important dollars that should be used for the direct provision of care or in support of our academic teaching and research missions on competition that is not going to create value. And there's this challenge of, do you create an anti-competitive environment by organizations working together? But I think we've learned that there are so many areas that we are not covering well. There are so many collective things that we do need to work on together in order for us to solve for. So, for example, health equity, to make sure that people of color have access and have outcomes that eliminate the disparities that currently exist. This is an area where I think collectively as Rhode Islanders, we need to come together and figure out how do we do that, and how do we apply the resources that have not been typically applied in the past to deal with and address health equity issues and disparities that exist because of structural, longstanding structural issues. So, to me, we need to be thinking about ways for us to collaborate. Dean Jane outlined a couple of dimensional areas, and one is in research. And there is certainly an interest in an announcement that was made regarding a three-party agreement between Lifespan, Brown, and Care New England around our research portfolio. The state of Rhode Island gets about 285, the three organizations I just mentioned get about $285 million in federally funded research, but they sit in the three different organizations. Could we look at our research portfolio together and think about how we could become a bigger player on the stage nationally in terms of biomedical research? And I think the answer to that question is, I think it's in Rhode Island's best interest for us to figure out how we can be doing research together under the Brown umbrella. The other areas of collaboration are around clinical care. There are already clinical collaborations that occur between Care New England and Lifespan, for example, by our two campuses at the Rhode Island Hospital. Rhode Island Hospital and Women and Infants sit on the same grounds. We have a tremendous amount of clinical care that we already share with each other. For example, if a woman becomes ill and needs ICU level care, she goes over to Rhode Island Hospital, and we provide OBGYN services broadly on that campus. So the opportunity for us to collaborate and think about how we can do it in a way that brings that value back to Rhode Islanders and eliminates us needlessly competing around areas that it doesn't make sense for us to be competing around. Now, I say this, and I'm not trying to create a environment in which we are, working to eliminate choice, but I think we do need to think about how we plow more value back into the direct care that our patients need and the families need in order for us to deliver healthcare for Rhode Islanders. There's a great competitive threat from organizations that are coming into the state, and a lot of people focus on the big hospital systems, but a lot of activities occurring that's more at the individual practice level, whether it's private equity acquiring physician practices or moving ambulatory surgery centers to for-profit centers. I think we need to look broadly across the different parts of the healthcare system and figure out how do we make sure we're bringing value back to Rhode Islanders and ultimately to the state, and whether it's the insurers or the state as an insurer through the Medicaid program or Medicare. I think we have an obligation to solve for that.
You mentioned the insurers, and that's an important element of the value equation. And you are new to our chamber board of directors, and we're really pleased that you're going to be able to participate at the policy level on all of these issues surrounding healthcare and public policy. And another new member of our board is the new president of Blue Cross Blue Shield, Martha Wofford. And in our conversations, Dr. Wagner, you and I were talking about the importance of, really having an excellent working relationship with the insurance community, with your insurer, and the insurer with their providers, et cetera. So what are you thinking in terms of, a different way of approaching these relationships in furtherance of, the overall goal of value in medicine?
Well, I think that I met with Martha Wofford a couple of times, and pleased to be brought onto the Chamber's board at the same time. She's terrific. Her experience nationally is phenomenal. Her passion about the move to value and what it takes, not just from a provider perspective, but from a payer perspective, and being willing to have an open dialogue about what is it going to take for us to get there, working in partnership with each other, has been just terrific. I think it's a unique moment in Rhode Island history that the head of Blue Cross, the head of Lifespan, Care New England, and the dean being relatively new is an important moment of a ability for us to collaborate and work together broadly. In our conversation that we had, we talked about the relationship between the provider side of the world, hospitals, doctors, et cetera, with the payer side of the world, those who are paying for care. Blue Cross Blue Shield is a very important player in the state of Rhode Island, And with Martha in the leadership role at Blue Cross Blue Shield Rhode Island, I think that we've already started to look at several ways of collaborating together that are the start of some of the most important transformational changes we need to make. We can only do so much. For example, Kent at Home wouldn't have been possible if we didn't have a payer partner being willing to pay for the services that we're now rendering in the home. Blue Cross Blue Shield in other dimensions is looking at payment reform as a way of accelerating this concept of transformational change in healthcare. I can't think of a better executive at the payer side of the world to be leading Blue Cross Blue Shield for Rhode Island and a real partner to the provider side of the world.
Well, from a business community perspective, the concept of paying for healthcare
Mm,
as an employer for
mm,
employees as part of the benefit program, of course, continues to be very challenging, and that's no
mm,
mystery and no surprise to truly to anybody. And folks that are watching this from the business community can certainly appreciate the efforts and the focus and the creativity that the four of you are exhibiting, leadership around cost containment, but with the notion of continuing to provide, excellent care. And that's really, where the rubber meets the road when somebody's in the hospital, not necessarily thinking about
yeah,
value on top of, everything else,
that's right.
when an individual is sick. Let me ask you about a topic that all business leaders are confronting these days, and that's around the issue of workforce and workforce
Mm,
burnout. And you outlined, many types of roles and jobs and positions. Particularly in your new Kent at Home Hospital at Home program. What is your observation around the ability to attract capable,
mm,
talented workers who really find a purpose and a passion within the hospital and healthcare setting?
yeah. There's no more important topic than our talent, and the thing that worries me the most. And I think we were in a collective state of denial up until about 2 years, maybe 3 years ago, when the pandemic started, about the permanency of our workforce, and most importantly, our nursing workforce is the one that I worry about the most. Talent development, talent acquisition, and retention are probably, not just for Care New England, a top priority issue, but for all employers across the state. We're a large employer. We employ about 7,500 to 8,000 employees in the state of Rhode Island. We too are looking at not only healthcare costs, but also our talent and talent acquisition. I think one of the things that I've not explored enough that I look forward to spending more time exploring is we have a rich set of universities, colleges, community colleges in the state of Rhode Island that can serve and have served as an important source of job training, development, and also as an anchor for Rhode Islanders, and also as an attractor for those who are from outside of Rhode Island to come to Rhode Island and make this their home. I think the collaboration between our educational organizations, starting in K through 12 and then moving up into college, is so vitally important for us to do from a workforce development perspective. I think states that spend time and really develop their workforce strategy are going to be winners going on into the future. And certainly it's been an area that Massachusetts has spent a lot of time on. And I think Rhode Island appropriately is doing similar work in terms of long-term workforce development as a collaboration between our K through 12, our colleges, universities, and then ultimately to the workforce to ensure that the Rhode Islanders have great jobs, get great pay and benefits that make this state the best place to live in the country.
Well, we also talked about the ESG movement, which is
Mm,
in
yeah.
full swing, and your previous experience and familiarity with the various constituent parts of the environment, social, and
Mm,
governance movement, and the degree to which employees today really look to their employers to be leaders and to be champions and want to work at places like Care New England that has an important community role and respects the role that they have as leaders
Hmm.
in the broader community. So your thoughts on ESG and how
Yep.
you're going to grow that presence
Yep.
over the next year.
Well, first of all, congratulations to you, Laurie, for the work you've been doing at the state level and with the chamber in terms of elevating the ESG as an important area for us to be focused on. And the work that you've done to catalyze us as a board and as a chamber holistically around the importance of this. One of the things we talked about that I think was a real an important point that you highlighted, which is increasingly employers need to speak to individuals, the younger generation, and the generational differences and changes in terms of what's important to people. People don't want to join an organization just for the pay. They join because they want to be part of communities. They want to actually feel like they're having an impact and a change, and they want to feel good about the work that the company is doing. I have 4 kids, they're all in their 20s. They care about these things. They care about the organizations that they work for. The old saying, the old slogan for Google was "Do no evil," and I actually think that the people want to join organizations that not only are not doing evil, but they actually are contributing positively. The ESG movement that you've been such a proponent of is really a way of expressing and talking about and categorizing the ways in which organizations need to respond in these regard. I think as on the environmental side, healthcare organizations have a lot of work to do in terms of their environmental footprint. It's certainly an area that we'll be spending time looking at the way that we're having an impact from an environmental perspective. I will say that probably number one on my list are more in the health equity side, because I think that falls under the social justice side of the work that we have to do. And this year, and under Jim Finale's leadership, who's the former leader for Care New England, and then continuing building on that, our health equity work and making sure that people have access and ability to achieve levels of health based on where they're at and helping them achieve the level of success in healthcare outcomes and processes that are so important. The last dimension on governance, our board has been very engaged in conversations regarding diversity and bringing in board members from a diversity perspective. This will be an important bit of work that I do with our board to further diversify our board and to create a more holistic set of voices at the table.
That's an excellent perspective. We really appreciate that and your feedback. We are coming to the end of our time together, Dr. Wagner. So, as we conclude, I'm wondering, might you suggest a few ways that the business community and the chamber specifically can be supportive of your new role and how we can continue to work together and in furtherance of your mission?
Well, so Laurie, thank you for first of all, the warm welcome to Rhode Island has been really terrific. This is a great state. People have been incredibly kind and have been super supportive. We're in the process of moving into the state we bought here, and we're very much looking forward. I think from a chamber perspective, networking becomes an important opportunity, and we've already started that with the first board meeting, an opportunity to meet business leaders from across all different industries is an important function of the chamber, and I certainly look forward to more networking opportunities. I think also being an advocate for doing the right thing, as you've done with the ESG work that we talked about in our last meeting. And I think that the last piece is that Rhode Island's a terrific state. We have all of these great organizations that are here in Rhode Island. I truly believe that it's the best place to be. And how do we continue to promote Rhode Island to be one of the best states in the country to live? And I think the chamber can be playing an important role in articulating why this is a great state to live, a great state to play in, and a great place to raise families and to do everything you want to do.
Well, you certainly summed it up beautifully. I couldn't have said it better. And we really appreciate having the board that we do have and leaders like yourself that truly care about business and our overall economy and our overall quality of life. So we remain very committed to working with you and supporting you, Dr. Wagner, and urge you or any of your team to reach out to us at any
Great.
point. For any assistance or insights, and we'll continue our advocacy and our networking and our ESG programs. So
Thank
thank
you.
you again. Have a wonderful day, everybody, and we will see you next time.
Thank you.